Hi there, I'm Dan Ellis. I'm one of the associate medical directors over here in the MGPO, and I'm also an anesthesiologist. I'm here today with Denise Gee to talk about the home hospital surgery, the home for gastric sleeve patients. Denise, as everyone knows, is a bariatric surgeon here at MGH, and Denise, thank you for joining.
Yeah, no, thanks for inviting me.
Absolutely. So, in compliance with the governor's mandate to limit elective procedures that require inpatient hospitalization and to deal with the COVID pandemic, we were talking, I guess it's been almost a year ago, about what we could do, not necessarily for COVID, but what we could do to address some of the needs of your patient population and how we could improve care. And in the process, we talked about an expedited discharge pathway, and that's actually what got us into the home hospital. So why don't you tell us about the pilot that was launched last week?
Yeah, for sure. So yes, I remember our fateful conversation that we had about a year ago. So, this operation was a laparoscopic sleeve gastrectomy, an operation that's very commonly performed, is actually the most commonly performed bariatric procedure right now in the world. And so we usually perform the sleeve gastrectomy and admit the patients overnight for one night and discharge them the next day, mainly to make sure that they're comfortable, that they can take in, they do well after the procedure, aren't in any pain, although usually they're not in that much pain. And then make sure they're taking in enough orally, that they're not bleeding, that their blood counts are stable. I mean, basically monitor them overnight and send them the next day. And this seemed like the perfect procedure to be able to consider sending patients home the same day. And when I heard about the home hospital program, I was like, this is definitely the way to go. Patients can basically recreate their inpatient hospital experience from home. So we would be able to monitor them, but they would be able to be in the comfort of their own, bed.
So we had your first patient in the pilot a week ago. And so the patient, let's walk through it. So we customized an anesthetic plan, a surgical plan, a perioperative plan. We sent the patient home on post-op day 0. So from the PACU, the patient went home, and then what happened?
Well, so we performed the operation. We made sure they were, comfortable a few hours later in the PACU, and then we sent them home. That evening, about 8:30 at night, a paramedic as part of the home hospital program went to the patient's house to get a set of vitals, just like the patient would have gotten had she stayed in the hospital. At that time, they usually have a PA who also kind of checks in, and given COVID, it's done virtually. But I felt like, given it was a pilot, I really wanted to be there and participate on that visit with the paramedic. So once the paramedic got there and got vitals, they kind of patched me in. I was able to see the patient, talk to her, make sure she was comfortable, feeling okay, make sure the vitals were stable. And sometimes you just need to get a look of the patient. So, just to see that she was comfortable. And then we disconnected, reassured her that we were all kind of available should she have any concerns over the course of the night. And then the next morning, the same thing happened. So a paramedic went back out. I was able to call in as well and talk to the patient, make sure she was doing okay. We were able to get a set of labs right on the spot, make sure her blood counts were stable, and it all worked out really well.
How was it for the patient?
She loved it. I mean, she was really excited to be our pilot patient. She was motivated to give this all a shot. And I think she felt really reassured that, we were there for her, that nothing that really was recreating what she would have gotten in the hospital anyway, but she'd be more comfortable at home. And she really, really appreciated the whole process.
And how was it for you as the surgeon?
With these sleeve patients, it's one of those things where 99.9% of the time patients do great. And every so often you have a patient who bleeds or gets sick, and you don't want to miss those patients by sending them home without all of the kind of stopgaps in place to make sure that they're going to be safe, and especially in this pilot. So I think it comes from picking the appropriate patients to send home on the same day. But then also, I really think the home hospital program offered a lot of security to both the patient and myself, to know that they would be cared for not only post-op day 0, but as well as the next morning. And so I really think it was very safe, and was led to patient satisfaction, but also provider satisfaction.
Awesome. Well, I enjoyed doing it. It was a lot of fun to reimagine the way we could do care and provide care in this difficult and complex time that we're in now.
Yeah, I think I totally want to echo that. And I think, looking forward at, new models of care, this is definitely the way to go for the appropriate procedure, and is also very timely, as you say, because right now, to free up a bed for more critically ill patients is crucial. And so if there are patients that were able to recreate the in-hospital experience at home in a safe manner, and free up beds and get patients home sooner, it's kind of a win-win on all fronts.
Totally agree. Well, thank you for joining me today. This was really great to chat with you.
Thanks. It was
Zoom
fun.
with you.
Yeah, for sure. Thanks.
All right. Take care.